welcome back. This is number 59, MTP number 59. I gotta say this, we had to redo this because I used the patient's full name. Waleed, I'd like to thank you very much for submitting this question, and I have some expertise with me today. This is Dr. Jake Fantus. He's a fellowship-trained urologist out of Chicago. Welcome. And he's going to be a heavy hitter up in Chicago, that I can tell you. So Waleed, and what you talked about is something that's been discussed over and over again amongst us urologists, and I'm going to get some feedback, like I said, from Jake. What you said was, out of personal experience, I use he calls it an O-ring with the penile implant. He means a cock ring, and I have to call it a cock ring because you can't go to a surgical device store to get these things anymore. You actually have to call them what they are. And he uses that, which serves as a perfect combination to complete a satisfactory intercourse with the penile implant. Good job, brother. I know we have some previous episodes where we talked about what you can do for glands that doesn't quite fill. We talked about how important it is that you have good testosterone levels because the urethra and the glands are all really dependent upon this hormone. But I had forgotten to talk about the use of a ring, and I'm glad you bring it up. And then you said, when the erect penis is measured after surgery, the inclusion of the glands in the measurement is not realistic, because is the glands tumescent or is it not? And this goes back, I don't know if you knew, you were in Texas for a little while. Run Wong, who's a very good friend of mine, he wrote a paper about how the penis is shorter after a penile implant, and I believe it's because he was not including a tumescent glands. That being said, the way that he describes it, he says that, this gives him a normal erection. All right. And if you go back to all the MTPs I've talked about, I always talk about giving you a penetrating penis. And I didn't even realize I was avoiding, describing an erect penis. Now, tell me, Jake, after a penile implant, what exactly is done to the blood supply to the glands?
Well, there are really two separate blood supplies to the penis. You have the blood supply to the corporal bodies, which we've replaced with the penile implant, and the blood supply to the spongiosum, or the area where the urethra is, the area that ultimately becomes the glands, is completely left intact. So we do nothing to that blood supply.
So if we do nothing to that blood supply, basically your untumescent glands or detumescent glands, it's the same as the non-erect penis. So this idea, Waleed, is awesome. So in other words, what he's describing is, as you get some blood flow to the glands, if you put the ring around, you will be able to trap the blood and have a more tumescent gland and a more natural erection after a penile implant. So Waleed, thank you for enlightening us and reminding me that I forgot something on one of the last MTPs. And Jake, thank you so much for being here today, and looking forward to tomorrow where we're going to do a bunch of implants. See you guys.